To learn more about how countries are managing to keep up with healthcare needs, let's bring in Dr. Joel Selanikio. He's a CEO and co-founder of Magpi. Thank you for joining us.
It's a pleasure.
So let's start with how these countries, especially with these rapidly growing populations, how are they managing to provide care for these growing populations?
Well, I think it's important to recognize the difference between health care and health. Health care being sort of things that happen in hospitals and clinics. And in many countries, in many poor countries, people don't really have any access to health care in that sense. But they do have access to health. For example, in India, the health of the population has dramatically improved in the last 40 years, largely through things like clean water efforts and vaccination efforts, et cetera, that have reduced child mortality. So they're not in the same stage as, say, the United States or other rich countries where really for us, we've done those things a long time ago. And now they're sort of trying to do those first basic things before they reach the same stage that we are.
And obviously looking at another country with a huge population, China, we saw there with their evolving family planning policy and having the two-child policy now. What does that mean in terms of not just healthcare, but also the supportive services to help health outcomes?
Well, it's been interesting in China because, 50 years ago, China and India were at similar economic development stages. Now, of course, China in the last 30 or 40 years has dramatically outpaced India. And so it's moved into a very firmly middle income, even moving in many places. It's hard to distinguish China from being, a rich country. So, of course, they have a very different set of circumstances than, say, India. And in China, though, like in the United States and in the richest parts of China, there's still the issue of how do you provide a large population with access to doctors. I think what we're going to increasingly find is that the road to health is not going to be towards providing access to doctors. It's going to be using other approaches. For example, technological approaches, AI, telemedicine, et cetera. Things that we're looking at in the United States for very much the same reason. It's too expensive to provide that many doctors to that larger population.
Now let's look at the role of technology, especially in China. Healthcare spending is estimated to reach about $1.36 trillion by 2020. So it's no wonder that you have these big firms like Alibaba trying to get in terms of market share. What role do you think technology will continue to play when it comes to China and its health?
Well, I think in China and in every country, technology is going to provide an enormous advantage. Again, in the United States, our problem is not that we don't have enough doctors, it's that the expense of the system is too high. So, of course, we look for ways to lower the cost. And recently, there have been very promising results in using things like AI or, again, telemedicine to lower the cost of access to a doctor or to the expertise of a doctor, even if that expertise is provided by a computer program and not by an actual physical doctor. I mean, as a doctor, I can say that certainly I don't think that the future for the United States or for China is to just say we're just going to grow enough doctors, train enough doctors to cover that whole population. China has a chance really in the same way that the mobile phone, I'm sure you've heard the phrase, the mobile phone has helped us to leapfrog over the landline system. And in many poor countries, they've simply skipped that. I think there's parts of the healthcare system that's been developed in countries like the United States or Britain or Canada that will be leapfrogged in the same way. They're not necessarily going to go through the same path. They're not heading in the same direction. So both we and India, for example, or we and China, may wind up in a future that involves very, very few contacts with doctors or hospitals or clinics, many fewer than today, but at the same time has a high standard of health.
And as you look at the sort of lessons that can be learned about countries that are managing health well versus those that perhaps could be a cautionary tale, what are the standouts for you?
Well, I mean, again, I think it's important also to distinguish between the things that really make us healthy and the things that are sort of nice to have, but not necessarily the essential ones. In the United States, as in every country, the real initial benefits to health, increasing lifespan, reducing child mortality, came from a clean water supply, came from alleviation of poverty, came from child vaccination, still come from child vaccination. So there are still huge gains to be made in many poor countries. China is already well on that path. India has dramatically reduced child mortality, but it's still probably, maybe I think it's about 50 kids die under the age of 5 per 1,000 that are born, whereas in the United States or another rich country it might be 5 or 6 or 7. So they've got a huge amount of travel still to go, just using these very basic approaches like making sure that vaccination is universal, making sure people have access to clean toilets and clean water. Again, none of those things are really anything to do with advanced technology. and nothing to do with seeing doctors or the healthcare system or building hospitals. So I think there's lots of those really just bedrock public health things that have to be done.
Right.
And also in terms of giving people access to more advanced care that we associate with doctors, I think technology is going to play that role.
Hopefully some governments will take that advice. Thank you so much. Dr.
Pleasure.
Joel Selanikio, CEO and co-founder of Magpi.